Hello again, I'm Dr. Ercan Karacaoglu. I'm from Istanbul, Turkey, and I'm doing surgeries in Chisinau, Moldova in Medpark International Hospital. Today we are going to talk about another widely known procedure of aesthetic surgery, which is abdominoplasty. We are doing a lot of abdominoplasty in Medpark International Hospital. I'm going to tell you some details, some brief details about this surgery. Who is candidate for abdominoplasty? Mostly the women who have abdomen sagging, mostly after giving birth or because of heavy weight loss, are the best candidates for abdominoplasty. When you are touching your abdomen, your belly, and if it's sagging, that means you need abdominoplasty. And what is the purpose of abdominoplasty? The purpose of abdominoplasty is going to give you a tight belly that mostly you have before giving birth or in your teenage period or like 20s. At the end of the surgery, you get a very tight skin and also the tight abdomen shape, which is a nice shape of the belt area and also the hip area. So it's not only tightening of the skin, but also it gives the nice contour of the abdomen, including the belt, which is supposed to be thinner, and then a nicely shaped, oval-shaped hip area. How is the procedure? The procedure actually is under general anesthesia, and mostly you are staying in hospital for one night. The day after surgery, you are discharged from hospital and you go home. In order to tell everything in detail, let me begin with the day of surgery. During the day of surgery, I'm going to see you in your office here in your hospital room, and I will do some marking. We mark a low bikini incision marking. This incision purposely is placed in the lower abdomen in order to conceal the final scar even with a bikini. So after surgery, you will be able to use a bikini and go to seaside without any scar. The scar is almost the same direction of the C-section, cesarean section. And this surgery, we take you to the room, and we have a very great facility here. And the surgery lasts about 2 hours. During surgery, if there is a need, we can fix your hernia or any abdomen problems in order to get a healthy abdomen shape. And we get the extra amount of skin, and we use almost the same section cesarean incision and fix the redundant skin and get a tight skin. After surgery, we take you to your room, your private room, and you stay for overnight. 2 or 3 hours after surgery, you start walking in your room, like the C-section or cesarean, but regarding the C-section, it is less painful procedure. The day after surgery, you are going home with a couple of drains, and 2 or 3 days after the surgery, we remove the drains, and finally, in 10 days, we remove all the sutures. Mainly the sutures are absorbable, but we call you in 1 week to 10 days for final follow-up. And there will be a couple of weeks, some swelling, but it's not going to interfere your daily life. Mostly for 1 week vacation will be enough for this kind of surgery. Thank you.